The IM board exam consists of single best answer questions only. This type of questions consist of a brief statement, case history, graph or picture, followed by a question and list of possible options. You must choose the one answer that's better than others. Note that other options may be partially correct. Familiarizing yourself with the question format in advance may help you work more effectively. This statement is from the ABIM official website. That's why solving board-style question is an essential part of board preparations. Reading and solving a question is an art. If we learn, it is a process in which we become more efficient, quickly eliminate the wrong answers, and improve our exam pace. Let's start. For the purpose of simplification, I divide any board questions into 4 parts: the intro, the body, the finale, and the multiple choice answers. The intro is typically the first line of the question. The body is the part between the intro and the last line of the questions. The finale is the last line of the question, and of course the multiple choice answers. Now, the 4-step process of reading any question is: read the finale and the multiple choice answers first, read the intro second, read the body third, and read the finale and the multiple choice answers once again. I hope you can see that reading the finale and multiple choice answer first makes the reading of the intro and the body more focused and critical, looking for hints and clues. Let's talk a bit about the intro. The intro of the question typically provides the epidemiology data of that questions and gives the first clue about the clinical problem we are being asked about. Board questions do not go against diseases epidemiology. For instance, clinical problems can be gender predominant. A question about lupus will never have a male patient in the questions because lupus is a female predominant disease. The same applies to most autoimmune diseases. Also, the clinical problem can be race predominant. A question about sickle cell disease will describe mostly a black patient in the question, and a question about thalassemia will describe a patient of Mediterranean origin. Also can be age predominant. A question about cholangiocarcinoma or pancreatic cancer will likely describe an elderly patient 70 plus years old. On the other hand, a question about congenital heart disease will always be about a young patient. Also, clinical problem can be risk factor predominant. For instance, a question about peripheral arterial disease will always have a patient with a strong smoking history. So you see here the value of the intro. Before I continue, if you would like to receive a summary of this video and access the previous video summaries, kindly subscribe to my Substack. The link is provided below. The body of the questions provide the history, physical exams, labs, imaging info, medication, etc. Most of the clinical clues are embedded within the body of the questions. The information provided in a question must be consistent and supportive without any contradictions. For example, a question describing hypothyroidism will never describe weight loss or diarrhea. A patient who has cardiac tamponade will never have normal vital signs in the questions. A patient with empyema will never have a normal WBC. A question about MRSA cellulitis will likely describe purulent cellulitis, etc. So each piece of info here will help us eliminate the incorrect answers and guide us toward the correct answer. Also, certain phrases guide us toward the correct answer, like the maximum dose likely indicate they want you to pick the next line of treatment. Also, the word purulent, as we said, indicates a bacterial infection that needs antibiotics. Some conditions are preceded by others, etc. The finale is the most important part of the question. You must understand what they are asking about. Your answer will likely be incorrect if you misread or misunderstood the finale of a question. How about the answers, the multiple choice answer? I highly encourage you to predict the answer after you read the intro, the body, and you go over the finale again. And before you go to the multiple choice answer a second time, try to predict the answer if possible. I pick the correct answer through the elimination of wrong answer rather than directly picking the correct answer. What do I mean by that? For instance, if I have answers A, B, C, and D, and the correct answer is D, I would eliminate A, B, and C instead of directly picking D. This way, I don't get deceived by the answer that comes to my mind first, or what I call an impression-based answer. The question will always have clues and info to eliminate all the incorrect answers. For example, I may suspect the correct answer is C or D. I take C and screen it against the question information looking for anything that will eliminate it. and I do the same with D. The correct answer is the one that is compatible with the information provided in the question. And remember, when I screen a question trying to eliminate an option, pay attention to particularly abnormal labs, imaging, or physical findings, certain physical findings. See if the age and gender help makes one option less likely as well. The more incorrect answers you eliminate, the higher the probability of picking the correct answer. It's just simple math. Sometimes you may feel two answers are correct and you cannot pick one over the other. There must be a clue in the question that would prefer one over another. So take another deeper look at the question trying to eliminate one answer. How about the question that we may feel clueless and have zero knowledge about? We still try to eliminate at least one option to improve the probability of picking a correct answer, if we can, of course, before playing what I call the guessing game. Guessing also is not a random process and should be planned ahead of the exam day. Again, guessing is only for the question that you cannot eliminate incorrect answer and you're clueless about it. Ahead of your exam, decide which answer you're going to pick for guessing. For example, you may decide that I'm going to pick option C in any question that I'm clueless about and have zero knowledge about it. The reason to have a predetermined answer is to avoid picking the answer that may sound or look correct just because we feel so, not because we know. Remember the following when you answer board style questions. Avoid the delusion that a question cannot be straightforward. Actually, a lot of questions are really simple and they are not trying to trick you into picking the common sense answer. Let's say you have a 60-year-old gentleman with a history of diabetes and hypertension who developed crushing chest pain. The most appropriate next step is A. 12-lead EKG, B. chest X-ray, C. morphine. There is no doubt that EKG, it's common sense, is the most appropriate next step unless you feel it's too easy to be true and there must be a trick. Notice that chest X-ray is not incorrect, but it shouldn't take the priority over the EKG, and this brings me to the next point. An option with a correct statement does not necessarily mean a correct answer. When you see two options that are opposite to each other, one of them is likely the correct answer. And remember, the board will not and shall not test you about any controversial issues. They only follow the approved guidelines or what's agreed upon between medical societies. In the end, to master the questions reading techniques, we need to practice. The process shall become spontaneous by the time of your exam. In the end, to receive a summary of this video, kindly subscribe to my Substack. The link is provided below. If you have any questions about this process, leave me a comment below or email me at this email. Thanks for watching, and if you found this video useful, please give it a like, share it with your colleagues, and subscribe to the channel if you have not done so. Thanks again for watching and see you soon.